medications at all?
No, I might take a multivitamin if I can remember, but nothing
but
else.
That's all.
Yeah.
Okay. Any allergy to any medications at all?
Not that I'm aware of.
No, that's good. Okay. Right, Millie. So before I discuss and talk you through the options of the emergency contraceptions, I just need to offer you a few things as well. You might want to consider this. Okay, so the first one that I would like to talk through about the infection screening.
Right.
So you don't have to be done today. Okay, you can come back. I'm more than happy to refer you to one of the GUM clinic. Okay, probably in 10 days time.
What's GUM?
So GUM is basically a dedicated clinic where they can offer you certain screening for sexually transmitted infection. Okay?
Right, okay.
So because what happens is they can offer you the treatment as well, which is very important for your future fertility in the future. Okay? So I'll give you some leaflets about that, so do think about it. Okay? And then the other thing is, before discussing about this emergency contraception, I probably will need to do some urine pregnancy test just to make sure. Okay?
Right.
And then I'll come to the options of emergency contraception. Have you had any thought or have you read anything about it?
Well, I know there's a pill you can take, isn't there?
Yeah. There is. Okay, so let me just go through all the options with you. Okay, so basically, there are 3 different types of emergency contraception that I can offer you. Okay, so the first one would be the coil. Okay. So with the coil, it can be given at any time within 5 days after your intercourse. Okay. And then it is very effective. And the good thing about the coil is, if you would like to think about longer term of contraception, then we can just leave it there for you. And then in the future, if you are thinking about pregnancy, we can just take it out. Okay.
So the coil goes inside then, is that what you're saying?
It goes inside. So yeah. So basically, when we put it for you, we put your legs up and then we'll kind of put a speculum in and then we'll put it in. Okay, so that's the coil. The other 2 are tablets. Okay, so the first one is called Lavonel. Okay, so it can be taken within the first 3 days after the intercourse. Okay, it is equally effective. However, sometimes it makes you sick, and that applies as well with the second tablets that I'm going to talk to you about. Okay, so the first tablet is it can be effective if it is taken within the first 3 days, and the second tablet is effective if it is within 5 days. Okay. With both of them, they can make you feel sick, and then it becomes a problem when you sit the tablets out, because then it won't work. Then we'll need to give you another one. Okay. So the other thing is, if you've been taking certain medications in the past, say like certain antibiotics, for example, for any reasons, then it won't be as effective as if you didn't have it. But as you said before, you were not on any medications before, you were fit and well. So I suspect that it shouldn't be a problem for you, because you're not on any medications before that. Okay. So either way, with any of those, okay, so I'll give you, you don't have to decide now, because you obviously still have time. Okay, I'll give you more information, and then if you want to have a read, then I'm more than happy to see you again, and then prescribe or do whatever you like to go. Okay. So far, any concern, any questions?
No, I just want to make sure they work, really.
Sure, yeah, absolutely. Then obviously, I just would like to mention as well, for your future reference, probably it's a good idea for you to start to think whether you want to have long-term contraceptive.
Oh, well, I was thinking about going on the pill anyway.
Yeah, that's really good, yeah. And I'm more than happy to, again, prescribe it for you, so that, once you done with this, you can always start with the pills. Okay. And then just other things that I need to mention, that whatever method that you choose today, I would recommend you to just do a urine pregnancy test in 2 weeks' time, just to make sure that that actually this emergency contraception is really work.
Okay, so what happens? Like, if I go for the pill, take one of the pills, and I'm not sick, then I wait for my period, or I wait for a pregnancy test.
So basically, I would say in 2 weeks' time, if you do get your period, and that's more assuring, okay. But sometimes, even pregnant women, they may have a certain type of bleed. So even if you start to bleed, I would still recommend you to do urine pregnancy test, just to make sure that it is actually your period, not something else. Does that make sense?
That's okay. So I'll take the tablet. Have a period, hopefully. Then do a pregnancy test. What happens if the pregnancy test is positive? What will I do?
Sure. So basically, if the pregnancy test is positive, so you probably want to think or consider whether you want to carry on with the pregnancy or do you want to have it stopped.
Oh, I don't like the idea of stopping it, but
of course.
If I do have a baby and I've taken all these different tablets, will it be all right, the baby?
Yeah, so basically, with the first tablets that I've talked you about, the Levonorel, there isn't any evidence that actually it is harmful to the baby. Okay. But with the other tablets, there are evidence that if you take them during the pregnancy, that they actually do some harm to the baby.
Oh dear.
Okay,
what would happen?
So because these are sort of hormones, so it affects on the baby's organ when they start to develop. So if for that concern, then I would recommend you to go for the first one, first tablets.
And that's the one I've got to have soon, so I think I should go for that one straight away.
Absolutely. Absolutely. You're still eligible for that anyway, so it shouldn't be a problem.
Okay. I mean, I don't want to have a baby. I'm at college at the moment, but I couldn't have a termination, really.
Yeah, there is options. Yeah, that's not a problem. So, even if that happens, then you'll come back to us and then we'll sort out things. And then obviously we'll discuss everything, like with every steps, we will always discuss it with you and give you the alternatives as well.
Okay.
Anything else that you would like to ask me, or have you made up your mind? Or
I think I need to take the one that's quick, isn't it?
Okay, sure, And
if it's going to work, it's going to work,
of course, sure. So what I'll do now, because you've kind of made up your mind, so I'm just going to prescribe it for you. Okay, so you'll need to take it, okay, and then you need to. I'll probably give you some anti-sickness as well, just in case. Okay. And then you just make sure that you keep the tablets down, for the next 3 hours. Okay. If you manage to keep the tablets down, then that's very good. Okay. But if you do sick, you need to come back, and I will need to see you again and see whether I actually need to give you the next tablets. Is that okay?
Yeah, of course.
And then once you go home, you just need to wait for your period or do the pregnancy test in about 2 weeks' time. And then if it's negative, then that's fine. And if you do get your periods, that's really good. Obviously, if it is positive, then you might want to have a think. And then if anything, please come back to us and then we'll sort out things. Yeah?
Yeah, okay.
Cool. Anything else?
Not really, no. I think that's most things covered.
Yeah, sure.
Hi, I'm Amy. I'm the pharmacist today. How can I help you? I was just wondering, I think I might need the morning after pill. Would you like to go into the consultation room and have this more privately? I just need to ask you a few more questions about it. So, why do you think you need...
Well, I had sex with my boyfriend and the condom split.
Okay, and when was this?
It was earlier tonight.
Can I ask you what age you are?
Yeah, I'm 14.
And what age is your boyfriend?
He's 15.
Okay. I just need to ask, but were you comfortable with having sex with him?
Yeah, no, I was. It wasn't anything like that. I was happy to do it.
Okay, no problem. Okay, so we'll move on. When was the last time you had your period? Is there any chance you're already pregnant?
I don't think so. It wasn't that long ago.
Okay. And do you use any other sort of contraception, or is it just the condoms?
No, you should just use condoms.
Okay. Are you having regular intercourse with him?
Yeah.
Okay. It's advisable that get you onto something else as well, just to make sure we don't have the same issue again. So we can talk about that later on, but do you have any other existing medical conditions?
I actually have celiac disease.
Okay, do you take anything for any medications or anything?
No, I don't need to take anything for it. I've changed my diet and that seems to be enough.
And do you take any other sort of medications at all? Okay, have you ever used the morning after pill before?
No.
Okay, well the medicine I'm going to give you this time around is called Levenel. Okay. And it's effective for up to 72 hours after you've had the sex, but it's more effective the quicker you take it. So I can give you some water now if you'd like to take it now, or I can give you it and you can take it at home.
I'd rather take it at home if that's okay.
Okay, no problem. So take it as soon as you do get home because it's more effective when you get home.
I'll take it straight away.
There's normally no side effects really, but the few that can be experienced are things like headache, abdominal pain, and there could be slightly irregular bleeding between now and your next period.
Okay.
So that's just something to watch out for. It is important though, if you do feel ill with it and you vomit within the next 2 hours, that you come back and get a repeat dose just to make sure that you have got a correct effective dose in this situation. Your period as well, so the next time you have your period, it could come slightly later or earlier than normal, but if it hasn't come within 7 days, we advise that you come and get a pregnancy test and just check that there's nothing wrong. It doesn't necessarily mean you are pregnant, but just because this pill has hormones and things in it, it can just imbalance what would normally occur. Have you got any? Are you interested in talking about regular contraception now?
I think I probably should, but I think I'd rather just go and talk to my GP because then they can actually give it.
Yes, that's okay. Well, I can give you a leaflet in the meantime that you can read and take with you, and you can ask all the questions you have. But if you have any other questions, you can let me know. Also, just because the condom did split, have you ever had any tests done for sort of STIs, any sexually transmitted diseases?
No, I haven't, but me and my boyfriend have only ever been together, and so I think we're fine.
Okay, no problem. Well, have you any other questions for me while you're here?
Just one. Is there a charge? Do I have to pay for this?
No, this time you don't actually, because we have what's called a PGD, so it means that we can give it to you for free, so you won't have to pay for it here.
Okay, that's great.
If that's no problem. If you have any other questions, feel free to come back and ask at some other point.
Thank you.
No problem.
If you are worried about becoming pregnant after sex, or your method of contraception has failed,